And good morning. I'm Dr. Deukmedjian here with a patient who traveled from Washington State to Florida to have Deuk Spine Institute procedures done on both his neck and his lower back. Now, he came to me with 2 herniated discs in his neck with lots of bone spurs, crushing the nerves, causing pain going into his shoulder, and mostly numbness and tingling and weakness on the right side. We went in with the laser yesterday. We found these herniation pieces, and there was a lot of herniation and bone spur you can see, and I was able to use the laser to remove them precisely. And now here he is today. How are you feeling with respect to your neck and your arm?
I feel great. I couldn't sit like this several days ago. I'd be like this to take the pressure off my neck. So for the last 4 or 5 months, I was in distress. So to be able to come here and complete 4 hours, I was in and then out going home with my wife. So it was amazing.
Now, you obviously had access to surgeons to do spine surgery where you live. What were you offered up there, and why did you choose to come here?
We have a place in Las Vegas, and we were kind of desperate, so I was in bad shape. So we found a doctor, went to get MRIs, and then the neurosurgeon there recommended a posterior
laminectomy.
Yes, it was devastating. I was depressed. Because we live up in the Seattle area, we already had an appointment because we'd had to get one way in advance, and then that neurosurgeon recommended an ACDF. And because of that recommendation from the Seattle surgeon, I began to look at YouTube to look at ACDFs to learn about that procedure if that's what I was going to get. And I found Dr. Deuk and the Deuk Spine Institute online on YouTube, and I started watching. I watched 3 ACDFs, and then I watched 3 laser surgeries on 3 people because that's what he would recommend while he's doing the ACDF. And so I went, oh, well, let me check that out. And after that, I thought, well, let me at least call down here, check into it.
How did you find that whole MRI review experience for your cervical spine?
Well, it was great. I had an iPad sitting on our table in the living room, and Dr. Deuk came on screen and asked me a few questions, asked me to do a few things with my neck, asked me where the pain was. He said clearly I needed surgery. My wife and I decided that we would fly down, go through the process, and so here we are.
Are you happy you came to Deuk Spine Institute?
Oh, big time, because also I have chronic sacroiliac joint arthritis from years and years of sports. It flared up after I had just had a shot to take care of the pain. It didn't work. So when I got down here just 2 days ago, I asked Dr. Deuk to look at it, and he thought it was a good candidate for the rhizotomy. And oh my gosh, you guys, I could start dancing now. So that's kind of amazing. On the same table, they just flipped me over. It was amazing.
Isn't that the best?
It's incredible. If there are any of you that are beginning the process of anything associated with the spine from top to bottom, you need to just go do some research on the Deuk Spine Institute. What Dr. Deukmedjian has started here is amazing. Years ago, it's been around for 25 years, 30 years?
The Deuk Laser Disc Repair is 20 years. We've done now, you are number 2,734. So we've done 2,734 laser surgeries in 20 years, and not a single complication. Not a single complication with any of the patients in 20 years.
That's amazing.
That's how safe the surgery is. Congratulations.
Thank you very much
for having faith in Deuk Spine and coming here.
Yes, you're my neurosurgeon from this point forward.
You bet. Anytime. You take care, sir. Enjoy yourself.
Thanks.